listening to Transformation in Trials. Welcome to Transformation in Trials. This is a podcast exploring all things transformational in clinical trials. Nothing is off limits on the show, and we will have guests from the whole spectrum of the clinical trials community. And we're your hosts, Ivana and Sam. Welcome to another episode of Transformation in Trials. Today we're going to focus on the topic of why purpose matters in life sciences. And for this, I have Jill Donahue in the studio with me, who is an author, speaker, a teacher, and passionate about changing the life sciences industry for the better. Jill, can you tell us a little bit more about your background and why you're so passionate about this space?
Sure. Thanks, Ivana. And thanks for inviting me to chat with you today. My story goes back quite a ways. When I first joined the industry, I came in with a background in psychology and noticed that everyone around me was really, really strong in the life sciences. That muscle, if you would, is really toned. But the other muscle, the behavioral science muscle, was not as well worked. And that was my fascination. So I started thinking, gosh, if both arms were equally strong, boy, could we do some good push-ups in the industry, right? If our people, the behavioral science skill of communicating in a way that would engage the person in front of them. So I studied this and did my master's in adult education with focus on influencing healthcare behavior change and was really fascinated learning about this. And then when I was 35, we had a tragedy in our family, and that was my father died as a result of a prescribing error.
Oh, no.
And so being in pharma, I thought, what if dad's doctors, rep, MSL, CAM, whomever, what if they had been better at that behavioral science muscle? What if they had been better able to engage and communicate, earn the trust, and collaborate with the healthcare team so they would have known the right product for the right time for the right patient? So this was super frustrating. I left Big Pharma 2 years after that because I kept researching it. It drove my research, really. You asked why. That drove my research, try to figure this out. And then I left Big Pharma because I thought, I've got to teach this to people. I've got to let my peers know that there's a better way for us to build trust, engagement, communication, and actually collaborate. So I wrote a couple books and then people started asking me to speak on global stages around the world, which was great. We started a nonprofit group called the Aurora Project to measure our path to patient centricity, because that's what I realized. Foundational to all of our ability to do better is to be focused on the patient. And I started talking about this before patient centricity was a term, but that's what it's evolved into. People wonder what that means, but the base of it for me is a mindset of being focused on what we are doing to help the patient. So I tried to figure out how to communicate that to people, how to help people articulate their own connection to the purpose. Work isn't just a job, but it's so much more. And that's where the power of purpose comes into play. We created a program many years ago now that has been, people say, transformational for them. And it is the work of my life. I just love helping people connect with literally the power of their purpose. So that was sort of a long answer to your question of why, but did I?
No, absolutely. And this is also how I encountered your work in the first place. It is exactly what you're referring to there. And when I saw it, I was like, wow, this is exactly what our industry needs.
Yeah. Oh, I'm so glad. Was it the book? We just
it was the book. Yes.
Okay. Yeah. Called A Dose of Inspiration, where we it's sort of like you, I get all these amazing conversations with people, and I would go into my kitchen at the end of the day and say, oh my gosh, you won't believe this story or this story. And then I thought, that's silly. I should share this with more people. So we put together this book.
And I really loved this perspective on that many of us who are in the life sciences industry, we do connect somewhat personally to why we are pursuing exactly this space. I was at a dinner with a bunch of biotech startups the other day, where we did kind of a round the table of how did we end in this space, all of
Yes.
us, and
Yeah.
everyone had some personal story to share of disease or clinical trials or
I
um,
love that. Yeah.
something else that happened in their life that led them on the path. And I think that's unique to our industry. People come here because they want to be in this space.
Yes, yes, indeed. And then sometimes over the days, weeks, months, years, reorganizations, restructurings, sometimes that focus on that why gets lost. And to the point where, some studies say 90% of people are not connected to their purpose at work, to the meaning.
Wow.
Yeah. And the US Surgeon General published something last year that said, a report last year that said, mattering at work matters, basically, that is key to our mental health. And sometimes, and maybe some of the listeners, this will make sense to, you sort of lose track of that. You get focused on the to-do list or the issues, the bureaucracy, whatever, and you lose track of, right, this is why I'm here. This is why this work matters and why it's meaningful to me.
That is a staggering statistic, 90%.
Right. Yeah.
That's most of us. That's
Exactly. And I think the thing is, Ivana, that people want to be purpose driven, but it's sort of smiling takes more muscles than frowning, right? Being purpose driven actually takes some effort and some work because it's so easy to just fall into the rut. It does take some effort, but the outcomes, the benefits of it are really, really amazing and very measurable. And there's lots of research out there that measures, that says, the best teams, the best organizations, why are they that way? Because they're purpose driven.
I could also imagine that, especially in our industry, where many of us take like small decisions on an everyday basis that can potentially impact the end products and how we engage with the patient and the drug itself, the safety of it, how we choose to deliver it,
Right.
small choices in manufacturing. Do we release this? Do we not release this? Do you think there's a tangible difference that can be made whether a person is feeling connected to purpose?
Yes. Yeah, I don't just think so. I know so.
Really?
Right? There's so much evidence out there. Examples like people reading x-rays. If they see the picture of the patient, will do a better job. They'll find things. Yeah, there's a lot of research from behavioral scientists like Adam Grant. He's done a lot of research in this area. To prove that it is so. When people are connected to the purpose, they do better work. I mean, I see it in the teams that we work with, the change in the collaboration, the trust, the enthusiasm, the energy, the grit, the perseverance, all these things improve when people are connected around the purpose. And when they see that the other people are as well, it just changes everything. But absolutely, without a doubt, I believe that we would need much less, we have very high rules, and I think we need less of the rules and just let people be guided by what they know to be true. When they're purpose driven, when they're focused on what's best for the patients, the creativity comes in for how we're going to do the clinical trials, right? How we're going to make it more friendly for patients, how we're going to include them. When we have that mindset, that's when the creativity and the innovation comes through. So yeah, and that's the other thing about this. It sounds like it's very soft, behavioral science and purpose, but the amount of evidence behind it, it's so funny because, everyone we work with is so evidence-based in the life sciences. And I just say, well, get evidence-based in the behavioral sciences too, and match them up. And it's just so powerful.
No, I completely agree. I would be curious to dive a little bit into this. In life sciences, we do have a lot of rules. We have a lot of regulation that we need to adhere to. And you're saying now that if we, in fact, were purpose-driven, we might not need the rules. But how did we end up with all these rules in the first place?
Yeah. I think there's we made a lot of mistakes in the 90s. We talk about, there's an elephant in the room when we talk about why we need the rules, and that's trust, right? That little but very big word, trust. And in the 90s, we could, talk for hours about what happened, but we can just summarize it to say, if anyone has seen the movie Wall Street, And the Gordon Gekko character in there, he has a famous line that says, "Greed is good." And that was the thinking, led by some writing by Milton Friedman, frankly. That was the thinking of that decade. Greed is good. And that's when we, increased the number of reps like a nuclear arms race. And we made a lot of mistakes, admittedly. Then that was depicted by Hollywood too in the movie Love and Other Drugs, if anyone saw that one, and other movies. Society does a good job of depicting all our mistakes for sure. But so we made those mistakes. So trust was broken. And then came many, many rules and regulations, which I'm all for, ensuring patient safety, obviously. And I think that we can help people make better choices if they're inspired with literally, again, the power of their purpose, when they're inspired by connecting to the meaning in their work and who they're doing this for, that one decision that ultimately will impact a patient, right? Will be a better decision when you're thinking about that patient at the end of it. That makes sense?
That makes total sense. I'm wondering, we as an industry, it is easy to put regulation in place. Well, relatively, if you can agree on the regulation. It is hard to take regulation away and loosen things up again. What do you think we as an industry need to do to potentially deregulate some of these things?
Yeah, I don't know that deregulation is going to be in our near future, but I think we can improve the adherence to what we know is important by helping people find the meaning, to help people be more patient focused, more purpose driven. I think we can improve.
Is this
where we're at?
Finding our purpose, is that an individual activity, or can it also be a company-wide or team activity?
Such a good question. Interestingly, sometimes people say, well, my team or my boss or my company, they're not really like that, so I can't. And I always say, yes, it would be lovely if being purpose-driven and patient-focused started at the C-suite and trickled down. That's ideal. And it can start with you as an individual, because you as an individual represent your organization to the rest of the world, right? Whether it's internal or external, you represent your team. So it can start with you. And I have a great story of Johnny Johnson, the bus driver. And he was very purpose driven, despite the fact that his manager was not. And he he's a great picture. And you probably have met Johnny Johnsons in your life too. And maybe I can just share the story with you.
Yeah, absolutely. Please do.
I met him, I was on a shuttle bus. So we had dropped off our rental car at the airport. And then, he drives that shuttle bus round and round and round all day long. And we got on the shuttle bus and his voice boomed over the loudspeaker. "It is my privilege to serve such an esteemed group of people today." And we all kind of smiled. Like normally, quiet passengers now are like, "What's going on?" And he by the end of our little route, he had us all smiling and happy. And I got off the shuttle bus and I said, "Johnny, where do you get this great energy from? I just love that." And he said, "Well, I had a choice to make." I said, "What's that?" And he said, "Well, when I came here," it was in Phoenix in the US. He said, "When I came here from my home country with my master's degree, I had a choice to make. What was going to be my purpose here? So was it going to be just driving around? Or could it be something bigger?" He said, "I decided it was going to be to make people happy." And I said, "Wow." I said, "So you go home with a smile on your face. You put these smiles on our faces." I said, "Do you make more money than the other guys?" He says, "Yeah." He said, "I make $100 a day." And I said, "What do the other guys make?" And he said, 40. I said, "So you more than doubled your tips by having this purpose-driven mindset, despite what was going on around you." I said, "Yeah." And he said, "One day I made 500. It was my birthday." I said, "Oh my gosh." And then he said, and this was sort of the key to everything here. He said, "But you know what?" He said, "People are smart. It has to come from here."
Yeah.
And he put his hand on his heart. And I said, "That's my whole workshop, right? This has to be authentic. We can't put this on, right? It has to authentically come from inside you. People need to connect with, remember back to, why can this work be meaningful? Maybe it was at one time, I work with a lot of healthcare professionals who have come into pharma and had to go through you left academia, or, PhDs, right? You left academia and you went to the dark side, or you left practice and you went to the dark side, right? And I find it really sad for them that they fall into that. And when I see them pump back up, they stand taller and more proud because they reconnect with their why. Like, why did you get into healthcare in the beginning? And now, how does that translate to your work in pharma now? That why is still there. Do you want to pause for that airplane?
Yeah, it adds some texture. It's fine.
I love your attitude.
Well, it doesn't have to be perfect. It's okay if it's imperfect. It's about.
I love that attitude.
The conversation. Yeah.
Yeah.
Yeah. I love the attitude of the driver you just mentioned. That makes a big difference. And that is a choice we can all make. Like, whether we are
exactly
in quality, or we are in manufacturing, or we're in sales.
Any role.
Yeah.
Ivana, exactly. So any role, I say, from the person at the front door to the person on the top floor, any role, we are all working to ultimately change people's lives, right? To improve patient lives. And whether it's in your leadership or not, it can be how you choose to see things. It is so fantastic when a whole team connects around the power of the purpose, and they realize, oh my gosh, Yvonne, I've worked with you for 20 years and I never knew that. And now I'm more inclined to assume best intent. I'm more inclined to forgive. I'm more inclined to reach out, right? We get this amazing collaboration. People play better in the sandbox, and gosh, the patients need us to play well in the sandbox together, right? It also changes, you mentioned reps, like it changes when people are out there trying to collaborate externally to say, hey, I know you might have a stereotype of me, because they do. But hey, I just want to give you a minute to share with you why I'm here. Here's just a little bit of my story of why I care so much. Oh, and any of your listeners that give presentations, it's amazing at the front of the presentation. Before we get started, I think it's important for me to share with you why I'm here and what my intentions are. I pursued a PhD in biochemistry because of X, Y, Z. And now I love using that expertise to take that information and whatever it is that is the point of their talk. It totally changes. The first 30 seconds of a presentation will make or break the engagement in your audience. And it better not be your disclosure slide, by the way, which I know it always is. But rather, it always is. But rather, why not start with why I'm here and what my intentions are, why this matters to me.
Yeah, that's a great tip. And again, finding that comes from the heart, something that's made you embark on this journey.
Yes. And maybe it's something that keeps you on this journey. Some people say, I joined pharma twice. At once when it was just a JOB, because frankly, the remuneration package was great for the lifestyle I wanted, people will say. And then, boom, some people say, it was the first hug I had from a patient, or when I first saw a patient on stage talking about the impact of the work we're doing, whatever it is, that journey evolves. So there might have been your original reason to go into science, your original reason to go into pharma, and then maybe other experiences that have happened that bring meaning and joy to your work. Yeah.
No, that makes sense. We've done 4 seasons of transformation trials now. We're recording for season 5 now, and a lot of part of the reason why Sam and I started this podcast originally was to investigate both what kind of transformation is happening in life sciences, but also what is holding it back. And so far, we have found a general trend that actually there are a lot of solutions to many of the problems we have in life sciences. What is holding it back is mainly, you can say, the human system within our organizations, within life sciences, but also in society more broadly. And that kills me a little bit, because that is fixable. We could behave differently.
Yes.
We can change that. And I feel like what you and I are talking about now, if we went back and connected with, well, what is it that we're actually trying to achieve? We're trying
Right.
to cure patients. We're trying to help manage diseases. How have we lost that, both as an industry, but also on an individual level? Because we're also a very profit-oriented industry, but we're more than that, and we can be more than that.
Well, and they go together. I never separate them because actually patient centricity leads to profitability. So yes. I have this image in the workshop that I teach, and it's the growth of a tree. So there's a seed, and then like a very small sapling, then a larger sapling, then a fruit-bearing tree. And so four stages here. And then I say, I've talked about four things. I've talked about profitability. I've talked about engagement, trust, and patient centricity. Which one comes first in this growth? And what would you guess would come first in the growth of the tree? So there was engagement, trust, patient centricity or patient focus, and profit.
I would guess people guess trust.
Yes, they do. Good for you. And then I say, yes, if we had that seed, we could drop it, but it fell out of the hole in our pocket in the 90s, didn't it?
It did. Right? Yes, you're right.
Right?
Yeah.
We lost the trust seed. So we don't have that seed to plant. What seed do we have to plant? Patient focus.
Yes.
Right? So we plant the seed of patient focus. That grows into trust. Trust is what empowers us or enables us to engage, that engagement that we can have with each other, that engagement with each other, that collaboration with each other, that then creates the fruit-bearing tree, the profitability, the seed, the drop from the tree, and that gives us more patient focus. So, and again, that's a simple way of summarizing some incredible research out there. So amazing research out there, and I can share with you references afterwards that says the most profitable companies are the ones that are purpose-driven. In fact, Albert Bourla, CEO of Pfizer, in his amazing book, Moonshot, that he wrote about the journey to the vaccine development, COVID vaccine development, he said, do you think it was the amazing technology? No. Was it the amazing science? No. He said what was key to the success was the purpose-driven culture. Mm-hmm. Purpose-driven culture. There's just so many stories and so much evidence that is what produces winning teams and more profitable teams. So people who think patient centricity and profitability are at odds, they are completely connected.
Yes.
It's when we have this mindset of patient centricity that we actually will be our best and our most profitable. It's a beautiful cycle.
It definitely is. And I think this also touches upon, well, you mentioned in the beginning, the behavioral science element, that in life sciences, we focus a lot on, you can say, the natural sciences. We believe a lot in that, but somehow as an industry, I often experience we overlook the behavioral sciences.
Exactly.
Why do you think that dynamic is?
Well, we have a certain academic path in our industry, don't we? A lot of people in our industry go through the life sciences, the natural science path, and perhaps never take a behavioral science course, right? So, and we value that academically, we value that in our industry. And that's something that I'm trying to change, is to say, hey, look over here. There's some amazing research that we can learn from to take that amazing life science, combine it with some behavioral science so that we can have our best engagement and collaboration.
Yeah, I think that's a great point. It's more about thinking science in general, I think, because there is science in all disciplines, and we should not be winging things where we actually have data and where we have proof.
I love how you said that. Exactly. We shouldn't be winging it because there is data and proof. But so many of the scientists and the people in clinical trials, for example, who are trying to communicate it, they're not familiar with the behavioral science for how to communicate it. I was just listening to your episode with Matt talking about even if the letter is written by a man to a woman, it's not going to be as effective in engaging them in the clinical trial. Yeah. Do you remember that episode?
Yes, absolutely.
Yeah. Applying some of the behavioral science to engaging the patients well, lots of evidence behind that.
Yeah. I do want to talk more about. We talked a little bit about the way that we engage with doctors in our industry. That we have this model, which is still, at least every company I've ever been in, this is the main way we interact with our prescribers. Is that we have this field force that visits doctors and talks about the drugs and hope to get more prescriptions that way. I'm curious, when you think about purpose and when you think about this broken trust, well, how does that manifest in that interaction?
Love that question. Yeah. So I've always thought, and I've been advocating that we need to stop calling doctors our customers or even patients our customers. I think we're all partners in improving healthcare, and that we need to approach our engagement with these people as a partnership. I'm here to help you find the right product, right time for the right patient, not here to promote my product. There's a lot of language I want to change in our industry.
Yes.
Promote my product. My product. This is a patient treatment option. And my competitor, I hate that expression. My competitor's product does this and my product does this. No. When we change our language, and that will be based on the mindset, right? Because when we go in there with that purpose-driven mindset, it's not my competitor's product about me getting a sale. No. I'm here to help you look at the treatment options because I have some expertise in this. I've been able to do a very deep dive in this one area. Doctor, I know you have to do deep dives or shallow dives in all of the areas, right? But I've got this very deep dive in this one area. So I want to, and they might not even know what product I'm representing, right? Because I'm there as an expert in this disease state, in the behavioral science around engaging the patient, in the follow-up, in the diagnosis, in the treatment options, lots of areas. I want to come as the expert, as the pharma person expert. I hope we stop calling them sales reps, right?
Yes, that would be helpful.
Might be, and that might be leaning in the trend towards more MSL type roles and less sales type roles. It's somewhere in them, and people are struggling with, we're not selling. Well, please tell me you're trying to engage them. Please tell me you're going to be an expert in engaging the doctor, right? It's not enough to just say, here's the science there. I've told them the science. That is so not enough. Right? Yeah. It's about finding out what their challenges are, what their headaches are, how are they diagnosing, how are they following up, and providing evidence that will help the physician, the healthcare professional, find a solution. So much more in the partnership mindset is the direction I want to see us go. That we're here, we have an expertise, you have an expertise, let's all come together and for the best interest of the patient at the end.
I think that also creates a more fulfilling role for the person. Yeah.
Yes. Imagine the difference, if you would, of being in your car. You mentioned the sales reps, being in your car and thinking, this doctor doesn't want to see me and I've got to go in there because I've got to make another call. I've got to have 6 calls. And if I mention my product 6 times, they'll remember it and maybe they'll say, and I'm going to go bother them. And, I don't want to go in. Versus the mindset of, I know from my research that there are X number of patients in this area that are undiagnosed and untreated, and they're at home suffering with A, B, and C, right? Yeah. I got to go in there to help that doctor know this is what that patient might look like. And here are the ways that patient will best be treated. So now I'm sort of an advocate for that patient, right? I'm going in there because I'm picturing those patients in my mind, and I'm going to go in there and do my best to help. Yeah. What a difference, right? When you go home at the end of the day with that energy.
It's a huge difference.
Yeah.
And also, like, from the medical side of things, I think that there's a difference between science and fact-based communication and lack of passion. Like, we can be passionate about the science.
Passionate about the science and about its impact on patients. Yes. And I think there's this misunderstanding that, my job is just to communicate the science or just to tell them versus engage them in it, right? But it's that taking it the next step to that, how does this make a difference? What is the impact of this? That is the key. It's not because the internet's right there. They can find all the science they need on there. It's that collaboration and the problem solving that will make the difference for patients.
An article online will not help you problem solve. It can inform you, but it will not help you.
Yes. Yeah. And that's why I want to get, the MSLs away from thinking that they're just there to inform, rather they're there to engage and problem solve, move things forward that way.
Yeah, and also I imagine it could take some pressure off the person in the field thinking, well, I'm here as the expert. I'm here to help. I'm here to engage. I'm not here to convince or force anyone to do anything.
Exactly. It goes back to language, doesn't it? Yeah. How we think of things comes out in the words we use. Yeah.
And that is interesting and would be a big shift, I think, both for mending that lack of trust. If we were the experts, we're just the people who, as you said, have dove in deep into a topic. We know a lot about that. We bring that in an engaging way. That's very different than our product is better than the competitors.
Oh, isn't it though? Isn't it though? Yeah, there's so much. And, I think about presentations, at all associates meetings, and it needs to start from that stage, right? How we talk about, instead of just the market share, and all those numbers are just so mind numbing for people. But when you translate that, you can still use the same numbers, but translate it into the patients versus the market share. It changes things for people. So yeah, language at all levels would be a big way of improving things. That
would be a big change.
Yeah.
Well, Jill, what are you most excited about that you're currently working on?
Oh, lovely. Well, I'm super excited about the book being out. As I said, I felt like it was not enough to just share these stories at my dining room table, but what if we could get them out there? So the book is free as a free download. We're trying to spread it as far and wide as possible. It features 100 purpose-driven leaders in our industry, their stories. I tried to do it from different countries, different roles, different departments, so quite a variety. So you can download it for free, and I'll send you the link. It's at my website, Accelerate, with the EX, accelerate.ca/freebook. And then people wanted a hard copy, so we actually now have it on Amazon. So people can get a soft copy. Yeah, it's kind of cool. We make no profit from it, but Amazon does. So it's Amazon's price of printing and their surcharge. It's on sale right now, though. I noticed they put it on sale. But anyway, it's on at Amazon. So it's a dose of inspiration, 100 purpose stories from pharma leaders. And it's the title is literally what I hope it is a dose of inspiration, either for people who've already been through our program. It'll help keep that, inspiration up, or for people who haven't, hopefully it'll get them to start thinking about it, start thinking about their story. So yeah, I'm super excited about that. Super excited about bringing our power of purpose to more people. That, like I said, I feel like this is what I was meant to do, frankly. I know my lifetime isn't long enough to bring it to all 5 million people, someone said are in our industry, but I'll do my best to light that flame. And then other people, like, it becomes something that they carry forward, and so on and so on. Like, that is amazing. So I love spreading that fire.
No, I love that. 5 million people. That's interesting. That's the population of Denmark, just in life sciences.
Is that right? There you go. In our industry.
That is quite a few people, but also that's why it must feel like such a close-knit community, because that is few enough people that we can actually, like, maybe someone who knows someone who knows someone, and then we kind of all know each other.
Absolutely. And I feel very positive about this change because I have seen the change in my time. Like I said, I started talking about patient centricity since before it was a word.
Yeah.
Right. This idea of focusing on the patient. And I've seen tremendous changes. Well, we have one company we work with, and everyone in the organization goes through the power of purpose. And they say when they're out there working with external partners, they'll say, we work with 17 companies in this space, but none of them do we trust more than you. Yeah. Like they have tangible differences. We see differences. And whether it's in teams and organizations or entire organizations, I see the impact of this fire. I call it a fire of being purpose-driven, patient-focused.
No, it's working. That makes sense. Yeah. It is.
Yeah, so I'm excited about that. I'm excited about how that will change healthcare, frankly. Yeah. I'm excited about how that will change things. I don't know the science that is needed to find the cure for Alzheimer's, like I desperately want them to find, right?
Yes.
But I do believe that my way of helping is to inspire people to be driven by meaning and purpose. That's how I'm hoping to make my difference. So yeah, I'm pretty excited about that.
That's the perfect segue for the question that we always ask our audience in the end. We don't ask our audiences. We ask this of our guests.
Of our guests, yes. You should ask the audience, perhaps. Questions from the audience, too.
Yes.
There we go. Just had another idea. Another book.
So, Joe, if I gave you the Transformation Trials magic wand, and this magic wand can change one thing in the life sciences industry, what would you wish for?
I bet you know. I bet you know what it's going to be. If I had a magic wand, I would wave it at every person and say, to help them light that fire inside to connect with their purpose. Unfortunately, it's not as easy as a magic wand. We've created this journey that it takes several steps, but man, is it worth it. But yeah, if I could bottle that up into a magic wand, that's what it'd be. Because when people have that connection to their purpose, and it's so tangible, it's so right there in our industry, right? Because we do such good work. I mean, anyone can find this wherever they work, but it's so right there in our industry. So if I could wave that magic wand and help people light that fire, gosh, that'd be pretty special. I think that would change a lot. A lot of people's lives, their happiness when they go home, as well as the people they work with and the patients they ultimately touch, their company, bottom line, everything. Yeah, that would be a really big magic wand. That would be really good.
That would be a ripple throughout the whole space.
Yes. Yeah, absolutely. And meanwhile, without the magic wand, I'll just keep plodding along, working on it, and talking about it, and continue to publish books and talk to people like you. And thank you again for showcasing this important topic of purpose and patient centricity. Really appreciate it. And I love the work you do. And you know what I didn't get from you was that I want to know, like, you are driven, right? Ooh. Doing this podcast, for example, on top of everything else that you do, where does that come from for you?
Well, for I want to know. Yeah, that's a great question. So for me, first of all, I feel like this is my second life. As a child, I had cancer. Wow. And survived that, and feel like somehow, well, this is my second chance. So whatever I do in life, it needs to matter. Like,
I love that.
So that's kind of the first purpose, and then growing. Goosebumps. Yeah. And the good thing about almost having died once is that, well, it's not so scary anymore. Like, what is a little bit of resistance, or what is a big challenge? Well, it's nothing compared to that.
Wow. Okay, I have goosebumps on my whole body. I knew from when I met you just a few weeks ago that there was a great story behind there, and that is it right there. I totally get it. It sounded like you were about to add something else to that. Was there something else?
And then my very specific experience with life sciences was, as a teenager, I had a family member who got Crohn's disease, and went through several clinical trials because there was no treatment that was working. And I kind of saw, well, both the incredible benefits of experimental treatment, but also like all the frustration of the patient experience in a clinical trial. And I thought, maybe arrogantly, as like in my late teens, well, you know what? I think I can help make this better.
I love that. And look at what you're doing just a few years later now.
Yeah.
Right?
Just a couple of years later, yes.
Yeah. Oh my gosh. I knew it. I knew there was an amazing story in there. I'm so happy to hear how you're using your life, like what you're doing with, the fifth season here of this podcast on top of your other work. It's just amazing.
Yeah,
driven to change.
I'm with you for solving and changing this industry. There's so much more we can do, and it can benefit so many more people.
Yes to that. And let's keep finding people who are doing it and showcasing them like you are. Thank you so much for the amazing work that you're doing and using your life so well for positive change and impacting so many lives that you'll never know, impacting so many lives with the ripple effect of your work. Thank you so much for that.
Thank you, Jill. And it's been an absolute pleasure having this conversation. And
You too.
I hope it does inspire people to find that purpose within themselves.
Yeah.
If our listeners want to reach out to you, ask more questions and follow-ups, where can they find you?
Sure. LinkedIn is the only social media I'm on. So Jill Donahue on LinkedIn. And then our website, accelerate.ca, accelerate like excellence and acceleration combined, accelerate.ca. And very happy to hear from anyone. I love finding other like-minded purpose-driven people or people who want to bring that to their team, to their lives. Happy to connect. And I can send you some resources that you can provide, some references and stuff that you can put in if you do that sort of thing.
Yes, we'll put them in the show notes so people can access them. Yes,
absolutely.
That would be great.
Yeah.
Thank you so much, Jill. This has been absolutely wonderful. It's
so great
my day.
Connecting with you, Ivana. Yeah, me too. You made my day. Thank you so much.
Thank you.
Take good care.
You're listening to Transformation in Trials. If you have a suggestion for a guest for our show, reach out to Sam Parnell or Ivana Rosendahl on LinkedIn. You can find more episodes on Apple Podcasts, Spotify, Google Podcasts, or in any other player. Remember to subscribe and get the episodes hot off the editor.